I see another potential problem with understanding this data, and that is that people have the possibility of feeling guilty if they have heart disease, and they're going to feel that they caused it by their own inability to deal with their depression.
Well, that is a possibility that is analogous to the kind of guilt that people would feel about not having managed their weight or their blood pressure or their smoking. I think as we understand that depression can contribute to the whole progression of heart disease, it does become both an opportunity for recovery as well as an opportunity for guilt.
You and I last met in person at the meetings of the American Psychosomatic, actually it was the Academy of Psychosomatic Medicine at its recent annual meeting. And I'm wondering if you might want to say a few words about the subspecialty of psychosomatic medicine.
Sure. The subspecialty of psychosomatic medicine received its authorization or certification as a subspecialty, I believe it was 5 or 6 years ago. It's the branch of psychiatry that takes special interest in people who have simultaneous psychiatric and medical illness or have substantial psychological consequences of medical illness. And so it requires clinicians who are particularly familiar with medical illness and psychiatric illness and can deliver mental health services in coronary care units, burn units, hospitals, outpatient clinics, cancer centers. I think it's a very promising subspecialty because it can provide the integration of mental health care and primary care in a way that really has not happened in traditional American medicine. And patients want it. I think it's cheaper and it makes better clinical sense to treat mental disorders in the context of physical disorders and vice versa.
Yes, and if people would like more information about it, the website of the Academy of Psychosomatic Medicine is www.apm.org. That's apm.org. And certainly if you'd like more information about this fascinating subject on the relationship between depression and the heart, I think Dr. Lawson's book, Treating the Aching Heart, A Guide to Depression, Stress, and Heart Disease, is a great place to go. The book is published by Vanderbilt University Press. I assume it's available on Amazon and other outlets like that.
And it's also available through my website, which is also a site for more public education.
Oh, yeah, please give us the site.
Which is www.lawsonwulsin.com. That's LAWSON
Okay, and we'll also put that as part of this podcast. Lawson, I'd like to thank you so much for joining me on Shrinkpod today, and I'll look forward to seeing you in the near future.
Michael, thank you very much for having Shrinkpod for the rest of us.
You have been listening to Shrinkpod, which has been coming to you from the campus of New York Medical College at the Behavioral Health Center of Westchester Medical Center in Valhalla, New York. This program is supported by a grant from the Sidney E. Frank Foundation. I'm Dr. Michael Blumenfield, wishing you a pleasant good day.